Many European countries have closed their borders to try to curb the spread of the coronavirus, and the effects are having an impact on some communities more than others. Lockdown measures in France have hit migrants particularly hard. Many are in the northern port city of Calais, from where they hope to cross the sea to England. Conditions in migrant shelters were bad before, but many say the lockdown has made them even worse. DW's Lisa Lewis visited migrant shelters of northern France and spoke to people there about how the country's response to the coronavirus crisis is affecting them.
There's no let-up in police procedure, even in these times of COVID-19. We are asked to move on because we want to film what's been an almost daily routine since 2018. Migrants are told to move their tents a few meters. Once the police have left, the migrants put the tents back. No one here wanted us to film their face, but the migrants told us they feel harassed.
They don't
see us as human beings. They don't respect us. They kick my foot. If you don't wake up when they come, they take away your tent. Then we have to ask aid workers for a new one and wait for up to a week.
Trying to observe social distancing here is difficult. Sanitary conditions are bad.
We're not allowed to go into town. Since the beginning of the pandemic, we've been stuck in these camps. Some of us were taken to shelters, but we had to stay up to 4 people in a room. That's illegal.
The migrants try to support each other as best they can, but that's also more difficult these days. This is where the Calais jungle was until 2016, when it was demolished. At its peak, some 8,000 migrants lived in this camp. Conditions were bad, but migrants managed to set up an infrastructure of sorts, and they were able to help each other out. Now, the authorities are trying to prevent the migrants from constructing another jungle by building fences like this one. Aid workers have had to reduce their staff at the camp by half. They say the government's response isn't helping the situation.
This is a real step backwards for migrants' human rights. There's no legal aid for them anymore. The evacuations continue and migrants keep getting harassed by the police. You'd have thought people would stand together in this crisis, but these vulnerable people are being left behind.
But authorities say that medical teams regularly check up on the migrants in the camps and that the evacuations are necessary.
We're offering shelter for up to 715 migrants. They can get medical care there. 353 people have already taken up that option. The migrants are being evacuated every 2 days if they are camping illegally. We need to prevent them from settling.
Aid workers say there aren't enough shelters, and many of the migrants would rather stay here and try to cross.
I'll never give up. One day I will get to England. My dream is to become a doctor, have real freedom, a nice house and a nice life.
Mangus wants to join 2 of his brothers who have already settled in England, but the corona pandemic has now made reaching the other side of the channel more difficult than ever.
DW's Lisa Lewis, who filed that report, joins us now from Paris. Lisa, your report shows the difficult situation migrants and refugees are facing in northern France. Are the camps there prepared for a potential coronavirus outbreak?
Well, that's a very good question. There were 3 confirmed COVID-19 cases a few weeks back, and aid workers have told me that several migrants there have been showing symptoms that could mean they have COVID-19, but no testing is available, really, and it's very difficult to keep a distance in the camps, even if the migrants are camping outside, but they're crowded together, especially when they're cooking, for example. So if there were a real widespread pandemic, or, a real lots of cases in the camps, it would be very difficult to contain them and to take care of all the ill people there.
It seems the people in the camps are coming under increased pressure from authorities who clearly don't want them there. But even if they were to leave, would they have anywhere to go?
It's very difficult for many people there, and many of those I've been talking to, have been on the road for years, 5 years, 8 years, 10 years. Many of them have been to other countries in the European Union, have been rejected when they filed for asylum there. And those I've talked to in Calais have all said, we're going to try to cross the English Channel, because in England they feel that they can pass unnoticed and maybe find work even if they don't have legal papers. But certainly it's a very good question, also because it's very difficult for all these people to find a place where they can settle down and have a nice life.
Lisa, good to see you. That was DW's Lisa Lewis there in Paris. Let's get a roundup of some of the latest pandemic news around the world right now. German state premiers are expected to approve a plan to allow all shops to reopen and get Bundesliga soccer going again. With New Zealand reporting no new cases for a second straight day, Prime Minister Jacinda Ardern dialed into an Australian cabinet meeting to discuss reopening borders between the neighbouring countries. Malaysia and India have begun to ease part of their lockdown measures, but both governments have urged caution as cases continue to rise. And Thailand reported its lowest number of new infections since March 9th, with no new case and no new deaths. Let's get some analysis now from Christian Lindmeier. He's a spokesperson for the World Health Organization in Geneva. Mr. Lindmeier, we're hearing a lot about lockdown measures being relaxed, infection rates dropping, etc. Is the worst of the pandemic behind us?
Unfortunately, I don't think we can say that. It's very normal and very good in some ways that lockdown measures are being eased. People will not be able to hold this for much longer. That's how it looks. And we need to bring back some normality to life and get the economy, of course, restarted or not damaged too much. But the problem with the coronavirus, with COVID-19, is that it's not like a water faucet. It's been turned off and there's no more dripping anymore. To the contrary, it's actually dripping quite a bit still. The infection rates, the daily infection rates have been lowered. But that means we still have daily infection rates and we still have quite an amount of cases. We still have people in emergency rooms. We still have severe cases. And we still have, unfortunately, deaths from coronavirus. But what will be happening now is that we need to learn to live with the coronavirus, at least for the foreseeable future, in case we have a vaccine. So we need to learn to deal on a daily basis with it.
Where do you see, then, the biggest risks, the main problem areas in fighting this pandemic right now?
Well, first, it's the infections itself, and it comes down to the testing, because the more we test every suspect case, the more we know and see a complete picture. We hear now reports from different countries in the world that there might have been cases even early on when we didn't even know there was corona circling. That could be possible, but we need to look into this. But again, the testing of every suspect case would be highly important to understand the picture we face in every country around the world. And when we know this, then we know how to respond, and we know how to hold events, what to do in schools, how to bring children back, how to open businesses again. This has an impact on everyday life.
Looking at Europe, what do you make of the way that Germany is dealing with the crisis, particularly its eagerness to reopen schools and the economy?
Again, so bringing children back to school is really important because it's bringing normality back to their lives. But it has to be done in a step-by-step approach. The whole reopening has to be done in a step-by-step approach. You ease a little bit, you monitor how your cases are climbing again or not, and that is possible. Because let's not forget, the whole idea of the lockdown was to flatten the curve. Remember that term. It was to spread out the cases over an amount of time. We never said it would stop, like cut off. It would spread the cases out over an amount of time. And that's exactly what's happening right now. So with the step-by-step approach of opening, open a little bit more, be cautious, see if it's working, see if not too many cases are rising so that the health system can cope with it, that the hospitals can cope with it, and then open more and open more and open more. Where this leads in terms of, for example, vacations or what the normality will be in August and September and October is difficult to say right now. Germany seems to be doing well if you look at the relation between infection cases and deaths, because that's nearly a leading situation in Europe. That is good to see, although, of course, every death individually is deplorable.
Mr. Lindmeier, thank you very much for speaking with us. That was Christian Lindmeier from the World Health Organization in Geneva.
Thanks for having me.
Research from a virus hotspot here in Germany is shedding new light on the spread of the virus in the country. A study from the hard-hit district of Heinsberg estimates that only 1 in 10 coronavirus cases has been diagnosed. It's highlighting the dangers presented by unidentified carriers as Germany takes further steps to open back up its economy.
The priority for these Germans was pretty obvious, queuing at the hairdressers first thing on Monday. One basis for the discussion on further easing of the rules might be found in a newly published study on COVID-19 cases in the western German district of Heinsberg. It suggests that 1.8 million people may have been infected nationwide, 10 times the number previously confirmed. A new and precise test for antibodies could help verify the exact number of infections.
The new test that Roche is presenting amounts to an important milestone in the fight against the virus.
Meanwhile, some states are pressing ahead. Saxony-Anhalt will now allow people to meet up in groups of 5. Lower Saxony announced the reopening of restaurants. Chancellor Merkel and others in her coalition fear that if different regions race to reopen, it could undo the successes achieved so far.
We're so close to the number where we would have exponential growth again. I don't understand why we can't be a bit more patient to secure what we have achieved.
On Wednesday, Chancellor Merkel and the German state premiers will talk about lifting more restrictions.
Yeah, patience is a difficult thing these days. Let's go to DW's chief political correspondent, Melinda Crane. She has more tonight here in Berlin. Good evening to you, Melinda. Let's talk about this study here. Were there any big surprises? And if so, what are their implications moving forward for the entire country?
There was nothing totally unexpected, but a couple of things do stand out. First of all, a significant share of those who had been infected, about a fifth overall, had no symptoms. And this absolutely underlines the importance of how we behave as we begin to relax restrictions on going back into public. Namely, you need to be wearing a mask, you need to be maintaining distance to other people, even if you feel fine, because otherwise you could infect them. Secondly, that 1.8 million number, more than 10 times as many people appear to have been infected as what was previously confirmed. Now, that goes to the question of herd immunity, the idea that we eventually could get to a point where this virus is less of a risk to health services and less of a risk to society as a whole, because a lot of people have already gotten it and become immune. But the fact is 1.8 million may sound like a lot, but that means there are still over 80 million Germans who haven't had COVID. So we are a long way from herd immunity.
Yeah, a long way from herd immunity. And that brings me to what the German health minister, Jens Spahn, what he was talking about maybe a week or so ago, about these so-called immunity passports. He has now reversed his decision to introduce a document like this for the time being. Why?
Because there was a lot of pushback after he made that proposal. And here's the thing. People are very worried that it would set up essentially a two-class system where you've got one group of people who've had COVID and recovered and get an immunity passport and can go back into society and work and play as usual. And then you've got a second group who still need to be protected, people who haven't had the virus. Now they, in that second group, would have a very strong incentive to try to get themselves into the other category. In other words, maybe they would stop taking precautions, hoping to get a mild case of the virus and then return to normal life. And that clearly is a situation with a lot of risks.
You know, we saw today in the country, Melinda, some students were able to go back to school today. The federal states in Germany, they're relaxing these restrictions on public life, and they're doing so in very different ways. Why is that?
That's correct. Well, the federal states do all have rather disparate population and economic situations. And some of those moving ahead, like the state of North Rhine-Westphalia, are very populous states and not terribly rich ones. In other words, they're under a lot of pressure to get people back to work, to try to get normal life started up again. But the fact is that there are real risks for all states if some push ahead faster than others, because obviously this virus doesn't respect either local or national boundaries, meaning if one state pushes ahead so fast that it sees a real upsurge in infections, that will undoubtedly spill over to other states as well. Now, the chancellor will be meeting with the heads of the federal states on Wednesday, and you can be sure this is going to be a big topic for them.
Our chief political correspondent, Melinda Crane, on the story for us tonight here in Berlin. Melinda, as always, thank you. Well, what to do about the crew? The German travel group TUI is planning to test nearly 3,000 cruise ship workers quarantined aboard a liner in the port of Cuxhaven. TUI says that it's using one of its own cruise liners called the My Ship 3 to ferry thousands of its employees home amid the pandemic. But the ship ran into trouble when it docked in Cuxhaven in late April with over a dozen crew members exhibiting flu-like symptoms.
The cruise ship that's now a quarantine station. The My Ship 3 is part of the TUI fleet. 300 meters long with a 2,500 passenger capacity. But no tourists are aboard, only crew, and they're stuck. With 8 confirmed cases of coronavirus, no one's allowed to enter or leave. Authorities in Cuxhaven are testing almost 3,000 people.
We will put those people in seclusion and in a special quarantine area on board, as well as the people they've been in personal contact with. We'll go on board with what we call containment scouts to do contact tracing. One deck of the ship has been prepared for this in case anyone else has to isolate.
The cruise ship docked in Cuxhaven a few days ago. Even if some of the crew look relaxed, the situation has put their nerves to the test. The mostly non-German staff have served for months at a time on various ships of the TUI fleet. After setting sail from the Canary Islands, they should have been able to set foot on land. But physical and mental health issues have surfaced on the quarantined ship. The cruise firm's management has declined to grant any interviews.
Broken furniture after outbursts of rage, pregnant crew members and unpaid wages. These reports of some crew members show a very tense situation on board. Of the many nationalities on the ship, there are alone roughly 800 Filipinos, yet it's completely unclear how and when they can be brought home.
Some are indeed eager to get home. Others dream of more travel. Martina and Herbert Westerkamp were aboard this very cruise ship in the Caribbean. When do you think you'll be able to travel again?
I hope it'll be in the next 2 or 3 months.
Maybe not abroad, but in Germany, I would think.
In the meantime, beach chairs sit empty on the North Sea shores. The locals of Cuxhaven hope tourists will soon find their way back and give the area a much-needed boost.
Nigeria is beginning to lift the lockdown in its 2 biggest cities, Abuja and Lagos. It's part of an effort to get Africa's largest economy back on track after a month-long shutdown. But many fear that the country is rushing prematurely to roll back restrictions and in the process, putting lives at risk.
The bustle is back in Lagos. Though the virus hasn't been vanquished, crowds throng the streets of Africa's most populous city, frequently ignoring physical distancing rules and the requirement to wear a face mask in public. Many are relieved they can earn an income again. Others worry new infections will explode.
I'm very, very happy. Now I'm in the market. I have gotten some money to feed my family.
During that lockdown, people are starving, complaining that they don't have anything to eat, and the government did not issue anything as an assistance for those that are in.
It is not a good idea to leave the lockdown. Personally, I felt if people are still at home, this virus disease will not spread.
The spread will get out of hand. Now they have eased the lockdown. That's what I think.
The easing of restrictions comes with a significant risk of overwhelming Nigeria's healthcare system. But in a country where 40% of the population already live in poverty, and with the economic damage mounting, it's also necessary for the day-to-day survival of those with no other means of keeping themselves fed.
And earlier we spoke to our correspondent in Nigeria about the pandemic and the damage that it has brought to Africa's biggest economy.
Well, the economy has taken the biggest hit when it comes to the lockdown. Lagos is the epicenter of the corona outbreak in Nigeria, and Lagos is also the commercial capital of Nigeria. So with shops closed, businesses locked down, everything basically on hold, you know what that means for the country. That basically means that the economy has been put on hold, not to add to the fact that Nigeria is an oil-dependent economy. And so with the collapse of the oil prices, Nigeria's economy has basically taken a huge hit in the whole coronavirus pandemic. And so experts are warning that the Nigerians should prepare for the worst when it comes to the economy.